Hi, I'm Dr. Miguel Gelfand, Head of Pediatric Surgery at the Cleveland Clinic Children's Hospital. What is esophageal atresia? So, esophageal atresia is a birth defect that basically the babies are born with an abnormal anatomy of the esophagus, meaning that the esophagus is not continuous, so it doesn't connect the mouth to the stomach, that the usual thing that the esophagus does. And so basically they cannot eat. Some of the times the esophagus are connected to the airway, to the trachea. So basically, not only they cannot eat, and also they can suffer some lung problems because of that. What are the different types of esophageal atresia? Esophageal atresia, when the babies are born, are divided basically in 5 types of abnormalities from the anatomy. The most common is the type C or 3, where the upper pouch is completely closed and the lower pouch is connected to the trachea. That's about 85% of the patients born with atresia are like that. There's 4 more uncommon types that basically the main problem is you have 2 esophagus that are completely separate that you need to bring in together and disconnect some of that parts from the airway after they are born, because obviously they cannot eat and they can have some difficulty with the respiration. What causes esophageal atresia? We don't have a real cause. What is the main reason why the babies are born with that? We know obviously it's a birth defect, meaning that once the baby is forming in the womb, there's some abnormalities that doesn't allow the esophagus to basically form properly. We know some common factors: older age in women, like more than 35, reproduction technologies like IVF, or babies with multiple births. Also some genetic syndromes that can be part of this malformation, but we still don't know exactly what causes esophageal atresia, unfortunately. What are the symptoms of esophageal atresia? Usually all the babies after birth in the neonatal period, they get a little tube that is called an NG tube, put it into the stomach to suck what is in the stomach when they are born. And obviously, because there's a stop in the esophagus, somebody will realize there's a problem. If that doesn't happen, they start coughing or choking or having some cyanosis, meaning they turn a little bit blue because they have difficulty with respiration. So that's very rare. Usually you will see some problems and you will have the diagnosis. How is esophageal atresia treated? All the babies with esophageal atresia need surgery to be treated, and hopefully that would be in the first 24 or 48 hours after being born. The main technique today is to do it by minimally invasive surgery, meaning you do 3 little incisions of 3 millimeters and you correct the malformation from the inside without opening the chest. We can basically reconnect the esophagus together and disconnect the esophagus from the airway. What is the prognosis for babies born with esophageal atresia? Usually the babies do very well after this surgery, and in 95% of the patients, all this goes with no problems and they resolve the anatomical problem and they can start feeding again by mouth in a short period. In the long term, those babies can have a completely normal life and do whatever any other kid does in their normal age. So basically, even the diagnosis at the beginning could be very hard to take. The ability now today with the technology that we have basically can solve the problem and having babies and at the end kids with completely normal life during their childhood.